Welcome back to Studio 5. You know, your face is the first thing people notice about you. And perhaps if you have wrinkles or acne scars, even uneven pigmentation on your face or on your cheeks, it can make you feel self-conscious. But there are things you can do to alleviate those problem areas.
Dr. Kirk Moore, he's a medical director at Genesis Medical. He's here to tell us about a leading-edge laser system called the fraxel laser. And some people are seeing amazing results with this laser. Kendra
Monson with him, a patient of Dr. Moore's, both joining us today. Welcome, you guys. Thanks for stopping in. Dr. Moore, what is the fraxel laser? Tell us what makes it different.
Well, it's a series of treatments as opposed to just a one-time treatment. And instead of treating the whole surface area of the skin, it only treats part of the surface area each time you get the treatment done.
Now we're going to talk to Kendra in a second because she's had the procedure. Explain to me how does it work?
Well, ablative lasers are a type of laser where it just shaves off all of that external skin down to kind of the skin where it's able to kind of regenerate itself. The fraxel does pinpoint areas, and so instead of shaving it off, it'll maybe only treat 20 or 22% of the surface area of the skin, and so really 80% of it's intact. You don't get a lot of sloughing, you don't get a lot of oozing, you don't get a lot of scabbing or any of that with the treatment.
Okay, Kendra, let's go back before your treatment. What were some of your concerns that you hope to alleviate with the laser?
My main concern was discoloration, pigment issues
on your skin. And talk us through before, what exactly was it on your cheek area or?
Yeah, on my cheeks and just sun damage and things, yeah.
Okay, and talk us through the procedure. How did that work for you?
You go in and they numb you up and then he takes the laser and just goes over your face like a lawnmower is how they would explain it. Making sure you hit every blade of glass or grass and cover your face in lines, and then you're off.
We're seeing some pictures here. This is of you getting ready for the procedure. Is that what this is, doctor?
Yes.
Okay. Yeah. And so you had we saw some of the slightly uneven pigmentation. You've had 4 treatments, is that right? And what have you found? What's the response? What's your reaction?
I love it. It's been great. Yeah. Absolutely enjoy it.
Your skin does. It looks really nice. It looks great. What about I know pain is a question that a lot of people have, and you're smiling. Was there a little bit of discomfort or?
Yeah, not a ton, no, just a couple ibuprofens and you're...
And you were out the door. You compared it, not as bad as a chemical peel even.
No, a chemical peel is a lot worse. In the chemical peel, not only that, I mean, because you're taking off all of the extra skin, so it's just a controlled burn. And so, it's just like having a bad raspberry, all over your face. And so, this is different. We numb you up. It's about an hour to an hour and 15 minutes of numbing. And so really the face just kind of you deaden the surface of it. Does it hurt a little bit towards the end of the treatment? Maybe a little bit, but it's nowhere nearly as bad as a chemical peel.
Okay, Kendra was telling us about uneven pigmentation. Some other areas that people can hope to see some results in this. If someone has like some acne scarring, that's something where people can see good results in this?
Yeah, acne scarring is always a difficult thing to kind of treat. Some of the deeper pitted scars, and a lot of times you have to do really deep chemical peels or deep dermabrasion, not microdermabrasion, but a deep dermabrasion, which is basically like a Dremel tool. And so this is an alternative to that. Again, a series of treatments will get you to the same endpoint without the downtime.
Dramatic before and afters, or what's the recovery time involved with the laser treatments? 2
to 3 days of recovery after the treatment, and I think Kendra will go along with that. I had a treatment done, I was back to work the next day. The people that didn't know me didn't know that I'd had anything done, but your eyes are a little bit swollen, your skin's, you can feel it's a little bit tight, but it's really, the recovery time is just a few days.
You were mentioning you've had it done, and I noticed you have like no eye wrinkles around you. Is that another area that people focus on, is eye wrinkles?
It's either that or Botox.
Making us guess.
So do people see this with the results with eye wrinkles as well, right?
Yes, you get improvement. It works really well for, we see some of the pictures here now, but it works really well for an overall resurfacing of the skin. It works really well for pores and pigment and early signs of aging, and then as you go through the series and as you get to the if each treatment is getting 20% of the surface area, by the time you've done the 4th or the 5th treatment, you've started getting 80 to 100% of your surface area, and then retargeting some of the areas that you treated on the previous treatments. And so then that's when you really start seeing the benefit in the lines and wrinkles and in the acne scarring.
And going back to Kendra's situation, the pigmentation, a lot of women I know struggle with that after childbirth with the melasma.
Yes.
We've got some before and afters of women who have experienced remarkable changes in their skin pigmentation through the laser procedure.
Yes, I mean that's again an overall facial resurfacing. We see a lot of pictures here with melasma, age spots, you know, sun damage, and just general irregular pigmentation.
Wow.
Let me ask you one more area, like neck skin restoration. Is that something that this also can target?
Yes, and again for the same reasons. But one of the limitations of a lot of the ablative lasers is they have to stop at the jawline of the neck. This can treat the neck, or this can treat the neck. It can treat the chest. I think Kendra had, you know, the neck and the chest treated. We treat back. We can treat. There's pictures of really bad sun damaged hands and forearms and everything. You can treat the whole body.
And how many treatments is standard? Kendra had 4. Is that pretty common?
That's pretty standard.
Okay.
The deeper, you know, the deeper the areas, sometimes you need more. So like really deep pigment, or you know, usually pigment's kind of treated with anywhere from 2 to 4 treatments. But anything that's deeper, like acne or deeper scars, or you know, those kinds of things, usually will take maybe up to 6 treatments to get it done.
And Kendra, you had 4 treatments. You know what it's about. If people ask you about it, what do you normally say to them?
I love it. Yeah, I would recommend it, absolutely.
Okay.
Thank you both for stopping in and
Thanks
spreading
for
the
having
word.
us.
And we'll have the information on our website. If you're interested in finding more about Fraxel laser, you can contact Genesis Medical at genesisinstitute.com.